We talked about meeting an eye specialist even without symptoms,
Yes.
correct? If a person is not wearing a glass,
Yes.
they still have to be evaluated once a year.
Yes.
Why is that?
No, because there are certain silent diseases
I see.
that can happen. A person may start when you're a kid, you may be developing certain diseases like a myopia, you may be developing, or as I told you, there could be a keratoconus that's happening, or there could be some other thing.
How about an adult? 30.
Okay, let's go to adults. In adults, silent thieves of vision. So, for example, glaucoma. In Hindi, we call it as kala motia. So, in glaucoma, the pressure of the eye, like for example, you have a BP, blood pressure. Similarly, within the eye, there is a fluid that is being manufactured, which is called as aqueous. The aqueous needs to be drained out. So if the production is more, which is hypersecretory, which can happen in some cases, but if the outflow has been compromised for whatever reasons, then the pressure becomes more and it does not help the optic nerve retain its function. Okay, so the optic nerve, I'll just maybe show you from here.
Yes.
So
You can take it with you.
yeah. So basically, if you are looking at the eye model, so you have the fluid that is manufactured and then it comes forward and it gets drained out. So these are the ciliary processes here which we talked about, and the fluid is then drained out. Okay, but if we look at the structure of the eye, so front of the eye has what is called as the cornea. So you have the cornea here, the light goes through the cornea and then it passes through the lens. Okay, so this is the lens, this is the lens. So it goes from the cornea, there is the lens, it passes through the lens and then it hits the retina. So this red portion with the blood vessels is the retina, and then the retina takes the message, goes, the nerve fibers go on to what is called as the optic nerve, and this goes to the brain, and this is how you get the picture. Okay, so glaucoma, the pressure of the eye tends to increase, and the optic nerves gets atrophic. That means it dies. Okay, the nerve fibers slowly get atrophied, and this is an irreversible blindness. Similarly, what I showed you on the retina, if you have diabetes, there could be changes of diabetes which is called as diabetic retinopathy. Retina means retina, retinopathy means that there is some new vessels etc. that is forming, and these vessels are leaky and friable. So they can cause bleeding within the eye, and these are not that easily reversible. So if you, and a lot of people come to know that they have diabetes maybe after 10 years of what they had diabetes etc. So these kind of things which can be happening very silently within the eyes, so that is what you have to kind of look at. Cataract may be developing, and typically what happens is that you just feel that your glasses number is changing. Yes, it does change with cataract, and you just go to an optical shop and say that change my glasses, which you are not actually looking at the root cause. So these are diseases which could be developing at any age, and nowadays I think with the longevity which is there, you need to look at it.
Follow Center for Sight and post your queries to get answers from the experts.